All right, so I'm going to talk about the specific types of hallucinations or delusions in schizophrenia. So keep in mind, again, like I mentioned, it's two symptoms of for 1 month plus 5 months of prodrome, which is before the active symptoms or residual symptoms. So kind of schizophrenia kind of wax and wanes. So it's one symptom of three major core symptoms: delusions, which are fixed false beliefs; hallucinations, which are typically auditory, though some say there can be visual ones, but in Hollywood it's kind of dramatized, like in the movie A Beautiful Mind. So let me kind of dive into that. So delusions, hallucinations, disorganization, behavioral disorganization, negative symptoms, which typically look like depression. So paranoid delusions are 60% of them. Paranoid patients believe that people are harassing them, chasing them, spying on them, spreading rumors, very paranoid. Like the FBI is after them. There's delusion of reference. So they see people like a normal event and they interpret it like, oh, they're talking about me. Or like the TV or radio are discussing him directly, right? So it's like they're referencing something that's normal on TV. They're applying it to like, why are they saying that about me? Delusions of control or influence, being controlled by outside force, like think like there's a transmitter rays are basically controlling their brain, right? That's one way. Delusion replacement called Capgras syndrome, where important people in their life have been replaced by imposters. So their mother's replaced by a stranger. Delusion of jealousy, their significant other is cheating on them, being unfaithful without evidence. Somatic delusions are very interesting. In the absence of medical evidence, they believe they have an illness or are being poisoned. So they're excessively worried about their body, but it's not like illness anxiety where they're worried about their anxiety. It's almost like they're thinking like there is something physically wrong with them. Like I've seen a lady that thought she had no intestines, and she kept believing that, which to me is far beyond anxiety because there's no realm of logic. There's grandiose delusions, thinking you're amazing, which tends to be with mania; religious delusions, which are very frequent; and technological delusions.